Hi, I'm Dr. George Pianka with the Hudson Valley Bone and Joint Surgeons. Today I'd like to discuss a condition that I see with patients complaining of numbness and tingling, primarily in their ring and small fingers, which is different from tingling and numbness in the opposite side of the hand, which is the thumb, index, and middle finger. The way the nerves distribute in the hand, the median nerve, the nerve that's associated with carpal tunnel syndrome, travels to the thumb, index, and middle fingers. The ulnar nerve travels around the inside of the elbow, then travels through the wrist area and goes into the ring and small fingers. So when I see a patient and they tell me that their whole hand feels numb and tingly, I get very specific with the questions and exam as to whether those symptoms are in the median nerve distribution or the ulnar nerve distribution. If the distribution is in the ulnar nerve, then the most frequent site of a problem is the elbow. The elbow is anatomically kind of a weak and vulnerable spot for the ulnar nerve. It doesn't have much protection as it travels between two bony surfaces. This is called the medial epicondyle. This is the olecranon. So it's kind of the funny bone area where people, if you lean on a hard surface and you rub against that part of your elbow, you might be pinching or irritating the ulnar nerve, and you'll feel that kind of funny bone feeling where you have some pins and needles shooting down into your hand, and that's because you've pinched the ulnar nerve. So when that symptom, the tingling and numbness, becomes intermittent, constant, disrupting sleep, or bothering you more when you're resting your arm on a hard surface, that means that the ulnar nerve may be compressed behind the medial aspect of the elbow. Now, there's not a specific activity that you need to do or need to avoid getting it. It seems to be an underlying predisposition. Sometimes the manifestation is more pronounced with certain trauma to the area, but most of my patients actually develop these symptoms spontaneously, and there's no specific way, unfortunately, that I can advise patients how to avoid this. So when the symptoms do occur, the physical exam dictates the severity of the condition. If it's pronounced and severe with pronounced numbness and maybe weakness in the muscles or early atrophy, then certainly patients are referred to a neurologist for nerve conduction studies, which test the nerve conduction across this area. There are special machines that the neurologist uses to measure how quickly signals are conducted from above to below the elbow across the ulnar nerve, and that correlates with the physical examination to decide on the degree of the nerve compression neuropathy at the elbow, so we can quantitate how bad the problem is. And the treatment depends on the severity of it. We can initially try night splinting across the elbow to see if that relieves the symptom. Some patients figure out what they're doing during the day, and in general, the more activities you do with your elbow flexed, such as holding the phone for prolonged periods of time, that can aggravate the condition. So sometimes taking precautions, avoiding certain maneuvers or activities that bring on the symptoms is enough to alleviate the problem. Sometimes the problem is pronounced, and then we have to discuss options, even surgery, to potentially stop this from progressing and then getting some relief by changing the anatomy in this area and making the nerve less vulnerable by taking it away from these two bony boundaries.